So, you talked about the standard of care. What do you mean by standard of care with cancer treatments?
You know, it's a really problematic reality. The standard of care is something which is not definable, and yet it's used as a instrument for keeping doctors compliant with maybe what could be called consensus. The real definition is what a reasonable doctor would do in a situation, but it's always something which the innovative doctors have to really exceed in order to stay helping patients. Conventional doctors are held to a conventional standard of care, but if we're doing something different, we have to be much safer and much more effective in order to be able to offer that to patients. And what irritates me, Ty, is that it really should be between the patient and the doctor. If I can explain a concept to a patient where I clarify the risks and the benefits, even if it's, for example, a non-conventional cancer treatment, not chemo, not radiation, not surgery, I think in America still the patient should be allowed to choose that. The standard of care says no. There's a standard of care, and the doctor must not vary his or her practice from that. But I think that the real issue is that the patient should be able to choose once they're fully and freely informed. Not happening today. It's a big challenge, as you know.
Yes, it is. So the standard of care in traditional, well, I say traditional, it's funny.
Yeah, we have to get our terms straight.
The treatments that have been going for less than 100 years are not really traditional, but in the typical treatments for cancer in the United States, chemo, radiation, and surgery.
Right, and it's illogical, because you know most cancer patients will say, I went for chemo and the doctor and the nurse told me any calorie is a good calorie, eat this cake, eat this cookie, eat this donut, just keep the weight on. Totally oblivious to the very well articulated, clearly demonstrated biochemical truths about don't eat sugar, don't feed cancer. So I'm not a fan of the current standard of care for cancer, and I can assure you that most oncologists, if they were honest with you, would say the same thing. They might say it's the best they have, but they're not happy with it. I don't think anybody's happy with 2.1 or 2.3% benefit over 5 years, which is what the research shows chemotherapy will give to an adult. So, so my situation is that the standard of care is clearly something which needs to be improved upon with cancer, and no one would disagree with that. The question is, how can we let science and reason bring us forward into a new era of patient care?